Welcome to Discover Health, a White Mountain perspective. I'm your host, Dr. Tom Barela. And today we have another special show that is a little bit on the edge, maybe. We're going to talk about marijuana, but we're going to take a little bit different of a tack today. We're going to only talk about the medical indications of cannabis or marijuana use. And to do this, we've asked a special guest, Dr. Doug Nichols, a naturopathic physician whose office is located over in Snowflake. And welcome to our show.
Thank you, Tom. It's good to be here.
All right. So cannabis, as you like to call it, rather than marijuana, and we'll use that terminology today, has been a controversial subject nationwide. And to my knowledge, you're the only physician up here that is involved with recommending cannabis use, at least from the state standpoint.
For the most part, yes.
For the most part, yes.
Mm-hmm.
So the first question to ask is, how did you get involved with this?
It's a good question. Honestly, I wasn't even planning on getting involved with this before, just not knowing all the repercussions to it, how you go about it and whatnot. And I had a patient that had chronic pancreatitis, and he was taking pain meds to address that, and they weren't working out too well for him. And possibly contributing more to the chronic pancreatitis. So there was a facility up here that had recommending for patients, and so I looked into it and told them, hey, let's go up there and give it a shot and see if we can get you set up for medical cannabis to address your chronic pain issue. And so went up there and looked into things, and in the process of getting him involved with that, they found out I was a naturopathic physician and said, well, would you be interested in working with, recommending the medical cannabis? Because that's what we do, is we recommend it. We don't really deal with the medicine itself or prescribe it. We just recommend it. So, but anyway, I told her I was possibly, but I'd have to look into it and see how the process worked and whatnot, and how it worked with the state, and slowly observed patients, observed how it was done, and finally decided to get involved with it. And since January of 2013 or 13, I've been involved with it, so it's been almost 5 years, and it's been quite an education, actually.
I'll bet it has been, and it's an education for all of us nationwide as we begin to see a shift to the medical uses of marijuana. And I always thought that it was appropriate that a naturopathic physician was involved with it, because it really is a medication that comes from a natural product, albeit a product that has controversial facilities about it. But I think many medicines have come from natural sources rather than the laboratory. So I thought that was an interesting association, because I know a lot of naturopaths are involved with recommending marijuana. Mm-hmm. Now, marijuana is still illegal.
Yes, on a federal level, it definitely is illegal, and is proclaimed a Schedule I drug by the FDA still.
So it's a FDA. So I know that allopathic physicians, the MDs, the DOs, cannot prescribe it.
No, they cannot prescribe it, and in essence, we don't prescribe it either. It's simply a recommendation process. So, and we'll probably be talking about that here in a little bit, but all we do is take the patient in and evaluate things, and then recommend them, and then they go somewhere else actually to obtain the medicine. So we don't deal with the medicine, we don't prescribe it at all. So
okay, so
same with MDs as well.
So you essentially are involved with recommending. So it's important for, as a disclaimer, to recognize what your role is in the dispensaries.
Right. With dispensaries, they're totally separate entities from us. And in fact, you hear about different dispensaries, and you can say what you hear and say, well, there's one here. Some people ask you, are there any dispensaries? You can say, well, there's a dispensary here, here, and here. But in regards to the medicine, that's kind of left on that aspect. We can talk to the patients about the medicine, the different strains and whatnot, and educate them a little bit about it. But in regards to dispensing it or prescribing it, we're kind of out of that arena. So.
All right. Well, that's an important question, because and you may not know the answer to the one I'm going to ask next. Is when somebody walks into one of these dispensaries, what is the educational background of the people that work in the dispensaries to know the correlation between the particular medical illness versus whatever forms of cannabis are out there?
In talking with patients, it varies. They'll say some dispensaries, some of the people who work in dispensaries have been with the business for a while. They understand the plant and they understand a lot of strains, because in the cannabis world, a lot of people, when they hear cannabis or marijuana, they'll think of Cheech and Chong or something you just get off the street, or it's just an herb is an herb is an herb. But in the reality of it, it's really a universe. There are different strains of it. There are different hybrids. There are hundreds and hundreds and hundreds of different types. And so sometimes in the dispensaries with different strains they kind of have an idea, and there are websites where they have studied them and show what areas, whether it's anxiety or different things that these strains affect more positively. And so they kind of go off that and experience of dealing with patients. But by all means, they don't have medical-based backgrounds or whatnot.
It's not like a pharmacist where you walk in, or maybe it is like a pharmacist where you walk in and they have some knowledge, at least.
They do have some knowledge
of the medications, but is there a certification? Do you know for?
I do not know.
Okay.
I'm not sure. And like I said, there's some that are more knowledgeable than others, and I hear feedback from patients about that in their experiences. So.
And that makes a lot of sense too. Mm-hmm. I suspect that's true for all of us, that there are people that are more knowledgeable than others. Well, let's go, before we get into the medical issues which are going to come.
Sure.
What is the actual process for people coming to you and what you do?
That's a good question, an important question actually, because some people, want to just go in and think they can just walk right in and get certified for a cannabis recommendation. And basically the process that we follow is followed by the state regulations. And so when someone comes in, first of all, or when they even call into the office, what's asked them is if they are seeing a doctor or if they have medical records. And so we have to have medical records to back up the condition that they're going to want to certify for. So chronic pain is, as seen statistic-wise through the states that have the cannabis, and with what I've seen, chronic pain is definitely the largest issue. And so we question them about I have an intake, I talk to them about the condition they're certifying for, get the background, just like I would with any patient coming in for a malady.
Yeah, in any type of illness.
Whether it was diabetes or whatever.
Uh-huh.
And then we get the medical records, or a lot of times they don't have the medical records, so we have to send a records release to the doctors, and we send record releases all the time. Several doctors on the mountain here and even in the valley, all over the state, we get medical records from. Once we have those medical records that confirm that, then we also have to go to the prescription monitoring program of the state, the pharmacy.
The
pharmacy
board
has that.
That lookup now where you can see what medications are on.
Yes, and there are schedule medications are on, whether there's Schedule 3, Schedule 2 medication. We have to bring that up. That's also by law, we have to do that. Do a review of systems, a physical exam, and that's pretty much it. And have the records, and then we fill out a recommendation form, and all those recommendation forms, we have to initial to the areas that the state asked for, seen the records, brought something up on the PMP, so on and so forth. And so there has to be medical records for it. And for us, in my practice and whatnot, we do not go forth with it unless we can have some medical background or records for it. We stay strict to that basis and pulling up that PMP. It's important. And the state really looks at that. That's a strong point with understanding. I mean, so.
That probably is very important for your licensing too.
Absolutely.
To make sure the medical records are corresponding. So most of the people that come to you have already gone through either the DO or MD workup, evaluation, treatment for the conditions that patients come to you for.
Generally, and if they haven't been to a doctor in quite a while, if they don't have insurance, which a lot of people don't nowadays, give them the option, go see a physician. Or being a naturopath, I can have medical notes as well. It has to be medical notes from a physician. I can establish them as a patient and see them over time for that condition and evaluate them.
So you're allowed to see them as a new patient and then adjudicate that they have a pain profile?
Yes, just like they would from another physician.
I
And
understand.
so, and you know, a lot of people go to chiropractors nowadays for physical ailments, and that's their bread and butter. But apparently in the state, according to my board and whatnot, we've been told that we cannot accept chiropractic notes and records. Under the law, they state a physician as someone that can prescribe medications, and where chiropractors cannot prescribe medications, they deem it that we're not able to accept those kind of records. So it has to be more in the NMD, MD, or DL, DO realm, or physicians.
I understand that, and I did not realize that was a restriction for acceptable medical records for you, because chiropractors treat a lot of chronic low back pain.
Absolutely, and that's, like I said, that's their bread and butter, and so I was surprised, but finding that out, we comply to that because we found out that.
So there is a strict set of rules that you got to exist under, okay?
Mm-hmm.
So let's kind of look at some statistics, and let's start the talk on, we're going to use the word marijuana, at least it's come up here, because that's what's in the literature, at least, although cannabis is certainly
more scientific
of it. So we have a slide here that shows some of the, or you have a slide here that shows some of the statistics for who uses medical marijuana.
Yes, in fact, and across the board of different states, it pretty much falls suit with these statistics. As you can see, with males are almost 2/3 of the patients that fall into line in using medical marijuana. And of course, the average age is shown, it's at 47. So kind of mid-age.
Middle age.
Middle age is kind of interesting.
Kids.
Yeah, kids. That's about my age. So.
Yeah.
Which is interesting because a lot of people think, and what was shown before, and I think this has probably evolved over time, because before, I believe it was showing more in the early 30s, in the 30s at one time, and a lot of people thought it's just the younger generation that are getting it. But as time goes on, where people become more educated, have more perspective on it, and doctors are becoming a little more familiar and comfortable with it, with what they're seeing, the outcome of their patients, more and more elderly patients are coming in. People even in their 70s and 80s are looking to the realm of medical marijuana to address their health maladies. So.
Actually, the statistics don't include anybody under 5, and they lump everybody over 60.
Sure.
and I don't know the statistics. These, of course, are from Colorado, because they have the best database and the longest right now use of medical marijuana. So people use it, and then the bottom of this tells why. Why do people really want to use cannabis?
Well, generally, as you can see, 90+% use it more for pain purposes. And in medicine, those in medicine know that some of the 2 top reasons why people see the doctor, one is fatigue, is a big one, but pain is a huge issue, no matter what health realm there is.
That's true. That's true.
And so 90+% are using it for chronic pain, and that pretty much takes the cake on the general conditions that are seen or used in medical marijuana. Muscle spasms are 25%. Of course, muscle spasms can tie in to pain.
They're very painful.
Very painful.
Anybody that's had a Charlie horse knows that they're painful.
Exactly. And of course, that ties in a lot. One of the conditions that falls in with muscle spasms is as those seen in multiple sclerosis. And so a lot of people that I've seen or you see with the muscle spasm that are categorized in that percentage, some of them are multiple sclerosis patients, because they do have a tendency to have painful muscle spasms, especially in the lower extremities. And so 25% kind of falls in that chronic pain aspect. Nausea, 15%, whatever the cause of the nausea may be, whether it can be induced by medications, whether it's idiopathic, they don't know what's causing it, or digestive issues or whatnot. Seizures, 3%, and the seizures can vary and range, but generally you see a lot of those with the younger generation.
Children,
more
towards the teens and the younger.
And one interesting aspect, Tom, on that, kind of going back with the recommendation process, if somebody is a minor, they're under the age of 18, which is, of course, childhood's from birth to 18 years of age, they have to have a caregiver. The parents have to be fingerprinted, obtain caregiver status through the state, And they also have to have 2 recommendations for that. So not only, say, if they were to come to see me, not only do we have to have the records for them being seen, usually it's a neurologist or someone they've been seeing.
Right.
They have to have my recommendation, and we have to send those records to another doctor to evaluate those and get a second recommendation from them before they are approved for it. So.
Oh, that's interesting. So for minors, it's more complicated.
Yes, and again, I know it's because of age, and they want to be careful with that. But seizures, more that I have seen, they've been younger children, especially if they've been born with genetic aspects or
abnormalities. Yes.
Yes.
Abnormal neurologic status. Yes. And you see lots of literature about how difficult it has been for parents of younger children to obtain marijuana treatment for intractable seizures is usually the most common etiology of it, rather than wanting to go through some of the brain ablation therapies that are done in the MD world.
One interesting thing too that's not listed on there is, and we're seeing more and more of it, is that the aspects of PTSD. We're seeing more and more people that are certifying for PTSD actually, and that's kind of been a whole realm with the vets and whatnot too. But the interesting thing too with the state, they put another caveat on the PTSD. Not only does the person have to have the diagnosis of PTSD, but they have to also be undergoing current conventional treatment for it to be certified. So that's another interesting thing about that.
So let's go on, and
Sure.
And the next slide, it talks a little bit about the scope of it, with a lot of Americans now having access to legal medical marijuana, and that's only going to change.
It will change. It definitely is changing. We've been seeing that over time through the laws that are being passed with the different states that are voting to have it medically and also technically recreationally as well. As you can see, 63% of Americans have access to medical cannabis now, or marijuana, legal medical marijuana now, and 29 states have those
29,
laws.
that's over half the country.
That's actually pretty amazing.
And it's going to only grow.
It will.
And obviously the annual growth rate is going up only as states begin to approve it and the sales go a little bit. And in the next slide, you've discussed here, maybe it's one of the easy consequences of this is that physicians' prescriptions for pain medicines drop. That makes sense, doesn't it?
It does. Yeah, it totally does. The fact that medical cannabis can kind of fit some of the bill to address chronic pain, obviously people are not going to go to other medications to address that, especially where other medications, there's different profiles of different medications and different aspects to them. The pain medication aspect has been quite an issue the last decade, and there's been a rising concern on that, and so some people are wanting to turn to alternatives, and so cannabis is one of those. And so yes, obviously the drop in pain medications that are prescribed will happen where cannabis or medical marijuana is filling that bill, if you will.
Yeah, I'm not sure I understand the next statistic that was out there, but apparently, with legalization of marijuana, it hasn't made a whole lot of difference or has dropped the illegal use of marijuana.
Yeah, with the medical use of it?
Yeah.
Yeah, and I'm not quite sure about the statistics with that. But that's always the hope, that with the medical change in it, that it will drop the illegalities of it, especially with cartel aspects and whatnot. So
perhaps more important is how many Arizonans have marijuana cards. 1 out of every 100.
Wow. Yeah.
1%.
1%.
1%. So let's go on and talk about some of the things that are really that people think of cannabis as being THC, but there's a lot of other preparations because it does come. And I noticed that in your slide here that there are some FDA-approved uses of cannabis derivatives.
There are actually, and as you can see, one that's approved for nausea and vomiting, especially associated with chemotherapeutic agents. You have dronabinol, or also known as Marinol. That is actually a synthetic THC medication that was developed for the nausea and vomiting. And so kind of like what you said earlier before about medicine taking natural aspects from plants and then converting it into a medication, Marinol is a example of that. Savitex, that actually, I believe, is a spray, and it actually is a 1-to-1 ratio. One CBD, which is called cannabidiol, and THC, which are actually the two most studied cannabinoids in the plant. And that's a spray, and it was mainly, I believe, in Canada and Europe.
In Europe, it's much more prevalent.
And it's mainly for MS, is what they were using it was for MS.
Okay.
Muscle spasms, the CBD, this is the cannabidiol I was referring to, CBD has actually become a huge thing. THC, which is actually the more illegal component of the plant, CBDs are actually all over the internet. Most of them are.
And you don't need a prescription for it.
You don't need a prescription for it.
It's hemp.
Generally hemp derived, yes.
Yes, hemp derived. Yes.
Most of it comes from Canada because it's a huge business there. Now CBD, it does not have psychoactive aspects, but it does have a lot of medical credence to it. And of course here it's muscle spasms, but CBD is also used for anxiety, seizures, and also have seen it used looking towards some cancer as well. There's just a lot more research going on about CBDs. So chronic pain and multiple pain, THC. Of course THC is the psychoactive component. There are pros and cons of THC obviously, but it does have it does help some pain, especially more where I see it, where it plays a role, especially when you get more THC content, is where as the pain gets more and more severe.
Then the THC becomes more and more
yes,
prevalent.
Yes,
in
but
its
being
use.
responsible with, of course.
Yeah.
So.
Okay. All right. So this is some of the background, and we want to really let people know what cannabis is approved for. In other words, you said you have certain licensing requirements
Yes.
for the recommendation of it. And there was a study published earlier this year on the health effects of cannabis and stuff, and we both have looked at that preparation for this, and by the National Academy of Medicine, and so science, engineering, and medicine actually, and so I want you to kind of go through this with your experience as a recommender versus how many of these maybe are on the list for the state too.
Sure. Now again, just with the basis of these are studies that have been done generally with the conditions that the state approves for in Arizona. Mainly the ones that are on there are because they felt there was probably enough research to back it up to be used for cannabis. I know anxiety is one that comes up that have tried to approve a few times, but it has been downed because...
And we have some of those kind of in-between places. But these on this slide are from what we call random controlled trials, where the evidence is high that there truly is these effective in these conditions.
Yes, so for example, the total conclusive evidence with muscle spasms, and as I mentioned before with multiple sclerosis, chronic pain, and nausea and vomiting have been ones where definitely there's conclusive evidence that the cannabis does help that. And I have absolutely seen that also with patients. Again, everybody's different. It's not always 100%, and it varies in its range of how it helps, but it is very effective with those conditions. Again, the moderate evidence, obstructive sleep apnea. Sleep apnea is not a condition that's approved in Arizona.
Okay.
So I haven't had anybody come in, honestly, for that. Usually they just go to the sleep lab or they're on CPAP or something like that.
Something like that, yeah.
Fibromyalgia, I've seen a lot of patients. And of course, fibromyalgia, and essentially they put moderate evidence. And again, it depends how you view what is the cause of fibromyalgia. But fibromyalgia falls under the chronic pain condition category.
Okay, that's true. Okay.
So in the way the state has us do it, we have to say chronic pain, fill out the box for that, but then we also have to put below what the diagnosis of the chronic pain is and clarify what that is. So whether it's degenerative disc disease or the lumbar spine, but in this case it'd be fibromyalgia. So again, with fibromyalgia, it kind of ties a little into the conclusive as opposed to the moderate. Multiple sclerosis, same thing. More in the multiple sclerosis, I've seen it more as it ties into the conclusive evidence with the muscle spasms. The cannabis actually treating the condition itself, I'm not sure in the way as you get it in a dispensary or whatnot in that form or how it is, if it actually works on curing the condition. It just helps.
Oh, no, I don't think anybody
Yeah.
thinks that cannabis is going to cure any of these conditions. Yeah.
But it's more, the muscle spasms is usually one of the bigger, or the pain aspects of that condition.
Yeah, a lot of this has to do with living with your disease
Yes.
and enough treatment to make life tolerable for you.
Just symptomatic control and whatnot. So
Right. That's what pain is, control. Some of these diseases, you really just can't stop the disease process in this manner. And that's important for people to understand. Okay?
Yeah, and and then the limited, you have PTSD, HIV, which are both conditions that are we can certify for in the state. Tourette syndrome, we cannot actually, which involves tics and whatnot. We cannot for that, although it's limited, but there's definitely potential there. Social anxiety, as I mentioned before, anxiety has not been accepted apparently because there hasn't been enough research to back it up. Although anecdotally, I have seen it do well for anxiety in patients, very well so, although the evidence hasn't really shown much towards that. Same with the TBIs, or the traumatic brain injuries, and I haven't really seen many people with that unless there was pain associated somehow with that, which falls more into the upper category there. So
I think, and the three classifications on this slide are really related to how much basic research has been done, and that the research has been positive in what's been done, and I think those studies will will go forward and get more and more generation.
Absolutely.
Now we're almost out of time, surprisingly, but I want to put this next slide up so people can look at least at it to say that there's insufficient evidence in a lot of these issues here, and I hope that none of these show up on the state's approved list.
Absolutely, actually, some of them do.
Oh.
Yes, absolutely, they do, and that's why, even though the evidence hasn't totally been,
worked out conclusively.
This, and that's how some of they are. They're not conclusive, and they're not saying it may not, and that's why it requires maybe further studies. But cancers is actually definitely approved. It is very approved in the state. Same with epilepsy.
But cancer approved for nausea and vomiting, and
more of the things that are associated with the cancer, the pain,
nausea, and vomiting.
Yes, now, and in fact,
not the cancer itself.
Yes, and that's where the state is more not treating the cancer itself, but more the pain, nausea, and all those associated with it.
All right. Well, we are almost out of time. I'm just impressed that it went so quickly with you.
I know.
But it's important that people understand the process, and it's just not the ability to walk into an office and say, I need some marijuana. I need some cannabis.
And if it does go that way, it's not the way it's supposed to go.
Right. Well, hopefully this program has given you at least a small insight and to indicate that we do have a resource here on the mountain for the proper dispensing of cannabis or marijuana. I hope that this has been informative for you, and thank you for watching. And thank you.
Thanks, Tom. Good to be here. Thanks.
Cool.